We'll be talking about the hypothyroidism symptoms now. Now, hypothyroidism is extremely common. We should know that when to call it as hypothyroidism. To call it as hypothyroidism, either T3 levels or T4, which are actually the thyroid hormone, should be less. And if it along with that, the TSH level should be high, or it can be normal also. So if the TSH levels are high, then we call it as hypothyroidism. If T4 level is low, we call it as hypothyroidism. And if the T3 levels are low, then we call it as hypothyroidism. So what are the clinical features of these patients? These patients very may not always have any symptom. These symptoms may be insidious, means the patient actually don't remember the day from where the symptoms have started, but most of the time the patient feels like maybe 2 months, maybe 3 months, maybe an year I'm having these symptoms. So presence of goiter can be definitely very renowned or very easily to make symptom, so that the patient may have large swellings in the neck which can be diffuse and which can be totally non-painful swelling. So you can simply accidentally see the neck swelling, which the patient knows of since months or since years, and he may not be bothered at all, he or she. So the other important clinical features are like the skin of these patients is really dry. These patients may have reduced sweating. So dry skin, reduced sweating, and thickened skin of the palm or sole, which we call it as hyperkeratosis. That is because of the increased dermal glycosaminoglycan content, which traps the water, and it increases the skin thickening without any pitting. Because in pitting, we very commonly seen in those patients who have kidney failure, heart failure, and this pitting typically tells that there is accumulation of free water. But in this hypothyroidism, there is actually this glycosaminoglycan content is increased, and it is not actually water which is significantly trapped. So we call it as mixed edema. One of the most typical feature of hypothyroidism is the puffy face or the moon-like face. So this puffy face, which actually involves the puffiness of the cheek, the puffiness of the uh, eyebrows, the puffiness of the uh, glabular area, the puffiness of the frontal area, and the puffiness below the cheeks or below the neck also. So overall, the patient's face looks puffy with the edematous eyelids, and these patients do have non-pitting edema on the shin of the leg. So whenever we see that there is no edema or there is no pitting edema on the shin and there is puffiness of the face, you should always think of hypothyroidism as one of the first differential diagnosis. One of the most important concern for which the patients come to the doctor is dry hairs, brittle hairs, difficult to manage hairs, and those hairs which fall out very easily. Because most of the patients, why do a female patient come to the hospital or to the doctor, is because either they are not looking good or they are having cosmetic issues. So, like puffy face means bad face, dry skin, dry hairs, these are all cosmetic problems for which the patient will definitely come to the doctor. The other one of the most important symptoms is constipation. These patients very commonly have constipation and weight gain. And weight gain, that too in that scenario that they actually eat very less. Very less means they will be eating maybe only 10 to 20% of a normal person's diet. Then also they will persistently have this weight gain because of the poor basal metabolic rate. So these are very important symptoms of a patient who has this hypothyroidism, of which this puffy face is very important. Non-pitting pre-tibial edema is very important. Dry hairs, easily broken hairs, which is extremely important. The constipation, weight gain, it is very common, and this weight gain, in spite of poor appetite, is very important. Now, the desire for sex is decreased in both the sexes. So there is reduction in the sexual pleasure, or there is reduction in the sexual activities. In females, reduced menses frequency is very common, or not getting periods is also very common in those patients who usually have long-standing thyroid disorders. But in those patients with hypothyroidism in early stages, these patients may have menorrhagia or increased menstrual bleeding also. One of the most important problem with the hypothyroidism, that is the increased incidence of miscarriage. So the fertility is reduced. This could be one of the important reason why the female patient or a couple comes to the doctor, that in spite of having multiple sexual attempts, they are failure they are failing to conceive, or there can be increased uh, episodes of miscarriage, and that lead to more investigation, and that is the time where we find this hypothyroidism as a problem. We know uh, hypothyroidism very commonly is seen with increased levels of prolactin levels. So at one instance we have reduced thyroid hormones like T4, T3, and at other instance exactly opposite, we get increased levels of prolactin. So more is the prolactin, it also adds up to this oligomenorrhea, amenorrhea, and reduced fertility and increase miscarriage. So this prolactin very commonly causes reduction or alteration in the sexual pleasure, sexual activities. It reduces fertility, and it causes galactorrhea, means expression of the milk. Those female patients, they complain that in spite of not being pregnant, my breasts are full of milk, and I'm expressing more and more milk, which is called galactorrhea, which is seen with the patients with increased prolactin levels. We should also understand that the contractility of the heart and the pulse rate is reduced in the patients with hypothyroidism. That could cause a reduced stroke volume and bradycardia. This could also be the reason why the patients with hypothyroidism, they feel weak, they feel tired, they feel exhausted, or they feel breathless whenever they go on for some activity or physical activity or for a walk. Along with this, there is increased peripheral resistance of the blood vessels, which could actually lead to hypertension, particularly diastolic. So this diastolic hypertension and this reduced heart contractility, reduced heart rate, can lead this patient to have the symptoms of weakness, lethargy, exhaustion, and shortness of breath. Stiffness, cramps, pain in the muscles is also a very common symptom of this hypothyroidism patient. Many of the time, a patient can come to the doctor saying that I all the time have cramps in my legs, cramps in my body. I do have body pain. My heel is paining, back is paining, neck is paining. I don't feel very fresh. I feel stiffness in the back, stiffness in the leg. So that could also cause by the hypothyroidism. So levels of TSH, T3, T4 must be always checked in those patients. Because of the hypothyroidism, there can be slow relaxation of the tendon reflexes when examined by the hammer by the doctor. One of the very important aspect of this hypothyroidism is memory and concentration. We must understand one thing, that in hypothyroidism, patients' memory and concentration ability can be markedly hampered, and this gets corrected as soon as we treat the hypothyroidism. So, calculative memory or uh, doing day-to-day routine work or using their memory at workplaces, it can be really tough for those patients who have hypothyroidism. In those patients, after treating this hypothyroidism, their memory and concentration may markedly improve. So these were all about the symptoms of the hypothyroidism. Thank you.